Thank you all for taking the time today. My name is Michael McIntyre. I'm also with the Northwest Kidney Council and based here in Seattle, Washington. There are two different main types of home dialysis: peritoneal dialysis, or PD, and home hemodialysis, or HHD.
PD, or in other words, peritoneal dialysis, is really done through the abdominal wall. The abdominal wall acts as a filter.
PD, or peritoneal dialysis, is a fluid in, fluid out type of dialysis that's done daily. And the nice thing about having daily dialysis is that you're able to help keep whatever residual function you have a little bit longer.
HHD, which is home hemodialysis, is done really similarly to how we do it in the in-center setting. This little machine does the same thing as the in-center machine. One needle out and then cleans it in the machine and then puts it right back into the body inside of the other needle.
In recent decades, home dialysis has become a bit more popular, and this is due to advances in technology, training, recent policy changes that make it more affordable. And according to the U.S. Renal Data System, about 12 to 13% of patients use home dialysis now. Home dialysis offers flexibility and convenience, but it also can lead to better health outcomes.
We see a lot of clinical benefits, including some just quality of life. So when we talk about mental health, that is definitely a benefit that we see in our home patients. Decrease in hospitalizations, a decrease in infection rate, an increase in transplant rates, yay, something that we all love. And Barbara just hit it. My favorite is preserving residual kidney function. And so first and foremost, if we can keep the kidneys working longer, by all means, we should absolutely try to do that.
Once a patient decides to pursue home dialysis, what's the process for getting them set up? Kind of what's the journey from going from in-clinic to home?
Well, and I think it kind of varies from area to area, but once we've received that MD referral and we like to meet the patient one-on-one, it can happen within days to weeks.
So what are the home considerations for candidates of home dialysis?
My personal belief, and I think a lot of the beliefs of our home nurses and physicians that are completely bought in to the home therapy, is that there's very few things that would exclude you from home. And where you can't do the peritoneal dialysis, you can absolutely do the home chemotherapy.
We're trying to break down those barriers that were maybe there in the past. It's all about being creative sometimes.
I really appreciate hearing from the advocates on this call and the proponents of more access to home modalities. This is a critical policy priority for kidney care partners.
How has the technology gotten better over the years, and what can we look forward to?
I would say a couple of things. The dialysis machines are getting smaller. They're becoming more efficient. They speak, I think, 15 to 20 languages now, and so that's not a barrier like it used to be. Somebody who has visual problems, they've got larger lettering and speaker prompts, and so there's all these things around the machine specifically that are really there to help aid patients in providing the care.
My mom 25 years ago was an in-center patient. She wasn't thriving necessarily in in-center dialysis, and home gave her the availability to do more frequent dialysis, which made her feel better. Then it also set her up to then get a transplant at Swedish Medical Center.
Thank you all so much for your time and joining.
Thank you. This was a fantastic conversation, and I wish we had more time.